This quiz will cover some important topics for the primary FRCA Viva. There'll be 30 questions. Each question will be followed by a 15-second pause, and then before moving to the next question, you may need to pause the video to explain each topic. Describe and draw the pacemaker action potential. Define and explain malignant hyperpyrexia. Describe carbon dioxide transport in the blood. Define pulmonary vascular resistance. Describe a volatile agent. Define and classify opioids. Draw the chemical structure of propofol, ketamine, and thiopentone. Describe and explain the sarcomere. Classify anticoagulant agents. Draw and describe the catecholamiine synthesis pathway. Draw and compare the acetylcholine and succinylcholine molecules. Explain the Myers-Overton hypothesis. Draw and define the Clark electrode. Describe how we can measure oxygen. Define work of breathing. Define pulmonary compliance. Draw and explain the three-compartment model with reference to pharmacokinetics. Describe the Mapleson classification of breathing systems. Draw and explain the key pain pathways. Draw and explain the physics behind a vacuum insulated evaporator. What are the factors affecting pulmonary vascular resistance? Define and explain the gas laws. Draw and explain the left ventricular volume and pressure loop. Draw and explain the coagulation pathway. Compare and contrast two volatile agents. Define and explain ventilation-perfusion mismatch. Compare and contrast lidocaine and bupivacaine. Draw and explain the arterial pressure waveform. Describe and explain the physiology behind the Valsalva maneuver. Describe how a pulse oximeter works. Draw and explain the JVP waveform.